Hi guys, this is a video on treating heart disease. It's part of the AQA Biology, GCSE Biology, and it's in the unit of organisation. So firstly, let's talk about coronary heart disease. So CHD occurs when the coronary arteries become narrowed by the buildup of layers of a fatty material. So you can see the coronary arteries on the outside of the heart, and they supply the heart with oxygen to the cells so that the muscle can then contract. The layers of fatty material are known as plaque. So this reduces the flow of blood, and it results in less oxygen for the heart muscle, which then can lead to a heart attack. So how do you treat heart disease? Well, you can treat it with things called stents, with statins, with replacing actual valves within the heart, and transplants, so heart transplants with either mechanical or actual donor organs. So we're going to talk about those four things. Your specification, that's the GCSE. They expect you to know about these four things, and they particularly need you to know about the advantages and disadvantages. Okay, so stents. Well, stents, they keep arteries open. A stent is a small mesh tube that is used to treat narrow or weak arteries. So you can see a picture down on the bottom of the screen, okay, and it's you can see the mesh, and the mesh is opened up by a little balloon that is inflated, and then it widens the artery. So the advantages are that they lower the risk of a heart attack in people with coronary heart disease, and they are effective for a long time, and recovery time from the surgery is usually quite quick. A few of the disadvantages, though: there are risks of complications. With all types of surgery there are complications, but also risks of infection as well. You could develop a blood clot near the stent called a thrombosis. Statins, they are drugs that lower the cholesterol in the body, so this slows down the rate of fatty deposits in the coronary arteries. Cholesterol, there's different types of cholesterol, but cholesterol can come from things like fatty foods and saturated fats, and they cause, as it says there, fatty deposits within the arteries. Now, statins, there are many advantages, but the key one is they are very effective. There's no need for surgery, as it's a medicine, and it can prevent CHD from developing over a long period of time. Disadvantages are, though, that with all types of medicines there could be possible side effects such as muscle pain, headaches and sickness. You cannot cure CHD, so the patient will have to take tablets for many years and probably for the rest of their life. It does take time for their effect to kick in as well. Replacing faulty valves. So inside the heart you've got main valves between the atrium and the ventricles, and sometimes the heart valves don't open or close properly, and this prevents the control of blood flow, so these are replaced with either biological or mechanical valves. Now, the biological valves are usually from pigs, and the mechanical valves, you can see, are usually made of some kind of metal such as titanium. So advantages: well, it allows the control of blood flow to the heart. It also is a long-term cure for faulty heart valves. Some of the disadvantages are, though, that obviously it involves major heart surgery, so there are large risks of infection and blood loss and actually things going wrong. Also, there are risks from using the anaesthetic during surgery. Heart transplants, well, what are they? So if the heart fails, a donor heart can be transplanted. So artificial hearts can be used to keep a patient alive whilst they wait for a heart donor. The advantages are that it's a long-term cure for most serious heart conditions, and it's the only way to keep a person alive. If it's a biological heart donor, if it's a transplant could be rejected. Again, a very major surgery, probably the most major surgery you're going to have. So there's risk of infections and blood loss. Again, risks from the anaesthetic used during surgery. If they're using an artificial heart as well, they're going to need an electric motor, and sometimes those can fail, or the batteries, unfortunately, can run out. Okay, so let's do a few questions here. So this is a question checkpoint. So if you've seen similar videos to this, you'll know what to do. If not, don't worry, I'll tell you what we're going to do. So what I'm going to ask you to do in a minute is to pause, read, and then try and answer these questions. And then I will go through these questions with you. Okay, so I'd like you to do that. So pause in 3, 2, 1. Okay, so let's have a look at this question. So this question is about stents, and they say a doctor puts a stent into the person's coronary artery, and you can see the blockage and the stent being placed in. It says, how does the stent help to prevent another heart attack give one way? Well, the main thing is it's going to keep the artery open, or the blood flows more easily, or more oxygen gets to the heart. So any of those answers would be acceptable. Then it shows a surgeon putting a stent into a patient, okay, and then it says they put the stent into an artery in the leg, moves the stent through the artery to the coronary artery, suggests 2 possible risks of this operation. So you can have any of these. So it could cause bleeding, there might be blood clots, you could get infections, the blood vessels might be damaged during surgery. And also, as with all surgery, there are risks from using anaesthetic. Okay, question 2. So again, I'd like you to pause, read and answer. So in 3, 2, 1. So this talks about valves. So this is about leaking heart valves, and they're replaced by a mechanical valve and a biological valve. And they give you lots of information about each. And then it says in the question, suggest 2, and 2 is in bold. So you've got to give 2 reasons why a patient may choose a mechanical valve and not, that's in bold again, not a biological valve. So we're looking at what the advantages of a mechanical valve. Well, if you look at the information and also from your knowledge, you'll know that they're long lasting, or you could say they're durable, or they don't break, or they don't wear out. There's no ethical issues in using them because you're not having to kill pigs. There's no risk of rejection because it's not biological material. And the last one, immunosuppressant drugs. So if you're given a donor organ or donor tissue from someone else, you'd have to take what we call immunosuppressant drugs. And all this does is reduce your white blood cells, so it stops them attacking the new donor organ. Then goes on to say B, suggest 1 reason why a patient may choose a biological valve. So what's the advantages of a biological valve over a mechanical valve? And basically, you don't need to take any anti-clotting drugs. It could be less leaky, okay? And it could be a better fit because it's an actual biological valve. The key thing is that you can't hear it. A mechanical valve, you can actually hear it opening and, well, you can hear it closing when it closes shut, whereas a biological valve, you won't hear it. Okay, next question. So this is a 6-mark question, I believe. This is, oh no, it's not a 6-mark question, sorry. So I'd like you to have a really good look at this. All right, they give you lots of information. You have to analyze that information. Okay, so I'd like you to answer it. So pause in 3, 2, 1. Okay, so it tells you that, gives you different information on biological valves, on a human heart valve and a cow tissue valve. So the doctor recommends the use of a cow tissue heart valve, and it says give the advantages and disadvantages of using a cow tissue heart valve compared with using a live living human heart valve. And it does say use information from the table. So you can use some of the information from the table, and then some of the information is from your own knowledge. So let's have a look at some of the examples made, examples of the points made in any response. So obviously you don't need all of these things for the marks, okay? So key advantages are for the cow tissue. Obviously there's lots of cows, so you're not going to be waiting so long for a cow valve. No need for tissue typing because you're going to have immunosuppressant drugs. It's quicker, it's less invasive. It's cheaper operation costs as well, and there's because there's less operation time, the anaesthetic risk is lowered. What's the disadvantage though? Well, it's made from a cow, so there might be religious objections to it. New procedure, so it could be unknown risks. Blood clots, you could get blood clots from a stent, or the stent could break. It's not proven as a long-term treatment, and it could be rejected. Okay, so that brings us to the end of this topic on treating heart disease. Hope you found it useful. Please do subscribe, and I will see you soon.